Hey, it's Tim Ria here live in San Francisco at the Digital Health Summer Summit. We have Lisa Suennen, who's a managing partner at Venture Valkyrie. How are you doing?
I'm doing great, thank you. It's been a good day.
So you got an awesome time slot right before lunch. Everyone is now filling themselves. And so the topic of the session was really interesting. It's called Sometimes You're the Windshield, Sometimes You're the Bug, Lessons Learned from Broken Business.
Right, yeah, so it was three CEOs whose businesses failed, talking about the lessons they learned and the assumptions they made that were wrong and things of that nature.
So to build your brand, what do you do and what is Venture Valkyrie?
So Venture Valkyrie is an advisory firm. I work with large companies, venture funds, small companies, helping them understand the digital health ecosystem, create partnerships, undertake strategy, et cetera. I spent the last 15 years in venture capital and the 10 years before that as an entrepreneur in the space, so I'm trying to use
War, battle wounds, and war. All right, cool. So let's get down to business. What was going on and what was hot inside?
Well, I think I really enjoyed the session I just moderated. Because I think it's very rare that you see CEOs frankly discussing the mistakes that they've made where things went wrong when they knew their business had to wind down and stop. How you disappoint your employees, your venture capitalists, et cetera. And I think the audience seemed pretty rapt about it because they very rarely hear people honestly talk about that.
Should you listen to your VCs, and can they take you off the tracks?
Well, I think you have to pick your VCs very carefully. First of all, your board really matters. I think some people think it's a very rote thing, but it's not. It really matters who your advisors are, and if your board's not great, as one of the gentlemen pointed out, you need to make your own sort of sideboard for people who can really advise you on your business. I think sometimes the investors get out of alignment with the business goals. Their timeline is not the same as the timeline for the company's needs to grow, and when that happens, bad things tend to happen.
Is the chasm, we talk about crossing the chasm in this digital health startup space, different than in, say, cloud computing or mobile apps?
Yeah, I think the chasm is much wider in healthcare because unlike in cloud computing for tech, you have a business, it has a problem, it finds a solution, great, thank you, I'll pay for that, end of story. In healthcare, the consumer of the services and products tends not to be the one who pays for it. So they're unwilling to pay for things, and so you've got to find indirect routes to the customer, and you've got to engage them in a way that often changes their behavior, and changing behavior of people is very, very difficult.
Exactly. So the end user is not the customer often.
Most of the time, yeah.
And I was listening in, and it sounded like, what was it? One of the gentlemen was talking about he's paying himself and the rest of the employees the same rate.
Yeah, well, I think it's a philosophy that if everybody in the startup is sort of equally incented, that they'll work better together, and I think that's probably true in some circumstances, but it doesn't overcome a bad business model.
So for the emerging growth companies out in this digital space, what are like 3 tips you could give them to get velocity and not get off track?
3 tips. Well, I think understanding your customers is so important. There's a whole movement around lean startup that says get out of the building and talk to 100 customers before you ever do anything else, before you complete your business plan. And I think that's so right on, and it's really important to make sure those customers aren't the normal ones that are within 5 feet of your office. You really got to go to the whole marketplace because it's very different from sector to sector of the U.S. I think also really thinking about your distribution partnerships and how you build mutually advantageous benefits there is really key. A lot of these businesses fail on distribution. And lastly is don't believe your own BS. You cannot drink your own Kool-Aid. When people start to tell you that it's not working, you need to understand why and not deny.
Venture Valkyrie, how do people engage, and what's the roadmap working with you?
The best way to find me is on the web. I have a blog that about 30,000 people read about. I write about healthcare and entrepreneurship and investing. It's venturevalkyrie.com. Very easy to find me there.
Okay. So that's Lisa, and thank you for being on the show. Cheers.
Bye-bye.